I absolutely think that at this point, the healthcare system is at a critical juncture.
Not only is patient care suffering, but the pressure of having to do more with less is having quite a profound impact on the nurses' physical and mental health.
The province's healthcare providers are still pressing for more improvement because things, they say, just aren't getting better.
We are very concerned for our patients' well-being and for our physicians and our nursing staff to be able to continue to do the work at the level that they've been doing without support. It is not sustainable.
Primary care is the center of many healthcare conversations now, but the challenges are broad.
Just even last week, I've heard from nurses at Lionsgate Hospital saying that their emergency department is in crisis.
ERs on the island and in the interior have shut temporarily because of staffing challenges. That's not likely in Metro Vancouver because teams have more backup, but it doesn't mean they're not running close to the edge. Hope is not lost, though, and the province and providers are at the table together, working on a path forward.
I do believe that because we're in a collaborative relationship right now with our government partners, that is a helpful space to be in.
What we're doing is hours and hours and hours at the highest level of face-to-face meetings with family doctors.
There are some quick moves in primary care, the doctors of BC think, that could make a big difference. First, address the increasing cost of running a private practice.
We need to stabilize that overhead payment. That is not a fixed payment for physicians that are providing services in clinics, and it's not okay.
Get more locum support to give family docs a break. And for nurses,
what we need to do is retain more nurses, and we need to come up with recruitment strategies for that, as well as retention strategies.
Coming out of the recent premiers' meetings in Victoria, the healthcare voices were calling for an urgent national staffing strategy and national licensing so practitioners could work across provincial borders. Well, the pandemic did show that healthcare can change swiftly. Dick says this is different.
This is a bigger and more substantial because it's a long-term problem. It's not an immediate problem. And we're taking action.
The province is trying a new lump sum offer for new family practice residents in lieu of the more common fee-for-service. It did not get rave reviews when revealed, and it's too early, he says, to know how many will give it a try. And overall agreements are now being penned.
So we have a new physician's master agreement, which is broader than family doctors, which is significant, that we're working on now.
So things are inching forward, but for the tens of thousands of BC patients without family doctors spending hours trying to get walk-in appointments, for family doctors struggling to keep the doors open, and for those on the front lines, soon is not enough.
When I think about the actions, I think about they needed to be here yesterday.
In Victoria, Liza Yuzda, City News.